Hi and welcome back YouTubers to my channel, an everyday life of an Aspie or life of an Aspie in general. Today I'm going to be bringing out to you another one of the body disorders, hopefully today to you all. This one is going to be all about celiac disease, I should say, excuse me. So let's begin this before I run out of time, and before I do, actually, as a disclaimer, as always, I'm no medical professional. I'm just your normal everyday Joe vlog. So if you see any warning signs and symptoms between yourself or your partner or your loved one, seek professional help for yourself or your loved one, as well as seeking second opinion for yourself or loved one, because I don't forever condone self-harm, regardless what it may be of these topics that I have addressed in the past or present. And also, basically, and a heads up to, basically, I would like to see you guys happy. So let's begin this. You may be wondering, as always, what's the very first question is, what is celiac disease, Aspie? Celiac disease is a gluten-sensitive enterotrophy, sometimes called Spur or celiac, is an immune reaction to eating gluten, a protein found in wheat, barley, and rye. Celiac disease is a serious autoimmune disorder that can occur in genetically predisposed people where the ingestion of gluten will lead to damage in the small intestines. It is estimated that celiac disease will affect 1 in 100 people worldwide. 2 in 1.5 million Americans are underdiagnosed and are at risk for long-term health complications. When people with celiac disease eat gluten, however, which gluten is a protein that is found in wheat, rye, and barley, their body mounts an immune response that attacks the small intestines. These attacks lead to damage on the villi, the small finger-like projections that line the small intestines that promote nutrient absorption. When the villi gets damaged, nutrients cannot be absorbed properly into the body. If you have celiac disease, eating gluten will trigger an immune response in your small intestines. Over time, however, this reaction will damage your small intestines lining and prevents absorption of some of the nutrients, which the clinical term for this is malabsorption. The intestinal damage often causes diarrhea, fatigue, weight loss, bloating, and anemia, and can lead to serious complications later on. In children, malabsorption can affect the growth and development, and on the other hand, in addition to the symptoms that may be seen in adults. Again, there's no cure for celiac disease or many other diseases or conditions I've shared with you all. But for most people, following a strict gluten-free diet can help manage symptoms and promote intestinal healing. The symptoms to look out for. The signs and symptoms of celiac disease can vary greatly from person to person and are different in children and adults especially. The most common signs for adults are diarrhea, fatigue, and weight loss. Adults may also experience bloating and gas, abdominal pain, nausea, constipation, and vomiting. However, more than half of adults with celiac disease may have signs and symptoms that aren't related to the digestive system that may include the following: anemia, usually resulting from the iron deficiency, loss of bone density, osteoporosis or softening of the bone, osteomalacia, itchy blistery skin rash, dermatitis, hyperpetiformis, damage to dental enamel, mouth ulcers, headaches and fatigue, nervous system injury, including numbness and tingling in the feet and hands, possibly problems with balance and cognitive impairment, joint pain, reduced functioning of the spleen, hyposplenism, and acid reflux. In children, however, under the 2 years of age category, would show typical signs and symptoms of celiac disease that will include vomiting, chronic diarrhea, swollen belly, failure to thrive, poor appetite, muscle wasting. Older children, however, may experience the following: diarrhea, constipation, weight loss, irritability, short stature, delayed puberty. Neurological symptoms including attention deficit hyperactive disorder, ADHD, learning disabilities, headaches, lack of muscle coordination, and seizures. Dermatitis, hyperpetiformis is an itchy blistering skin disorder or disease that stems from the intestinal gluten intolerance. The rash usually occurs on the elbows, knees, torso, scalp, and on the buttocks. This is often associated with changes to the lining of the small intestine identical to those of celiac disease, but the disease may not produce noticeable digestive system symptoms. Doctors treat dermatitis herpetiformis with a gluten-free diet or medication or both to control the rashes. The question next you'll be thinking is when to see a doctor. Consult your doctor if you have diarrhea or digestive discomfort that lasts for more than 2 weeks. Consult your child's doctor if your child is pale, irritable, or failing to grow, or has a pot belly and foul-smelling, bulky stools. Be sure to consult your doctor before trying a gluten-free diet, however. If you stop or even reduce the amount of gluten you eat before you're tested for celiac disease, you may change the test results. So always check with the doctors first. Celiac disease tends to run in families. If someone in your family has this condition, ask your doctor if you should be tested. Also ask your doctor about testing if you or someone in your family has a risk factor for celiac disease such as type 1 diabetes. Causes. Celiac disease occurs from an interaction between genes, eating foods with gluten, and other environmental factors, but the precise cause isn't known, however. Infant feeding practices, gastrointestinal infections, and gut bacteria might contribute to developing celiac disease. Sometimes celiac disease is triggered or becomes active for the first time after surgery, pregnancy, childbirth, viral infection, or severe emotional stress. When the body's immune system overreacts to gluten in food, the reaction damages the tiny hair-like projections villi that lines in small intestines. Villi absorb vitamins, minerals, and other nutrients from the food you eat. If your villi are damaged, you can't get enough nutrients, no matter how much you eat. Some gene variations appear to increase the risk of developing the disease, but having those gene variants doesn't mean you'll get celiac disease, which suggests other additional factors might be involved. The rate of celiac disease in Western countries is estimated about 1% of the population. Celiac disease is most common in Caucasians, however, it is now being diagnosed among many other ethnic groups and is being found globally. The risk factors. Celiac disease can affect anyone at any given moment in time, depending on the age, and however, tends to be more common in people who have a family member with celiac disease or dermatitis, herpetiformis, type 1 diabetes, Down syndrome or Turner syndrome, autoimmune thyroid disease, microscopic colitis or lymphocytic or collagenous colitis, Addison's disease, rheumatoid arthritis. The complications you might find. If untreated, celiac disease can cause malnutrition, which is the damage to your small intestine, meaning it can't absorb enough nutrients at the time. This can lead to anemia and weight loss. In children, malnutrition can cause slow growth and short stature. Loss of calcium and bone density. Malabsorption of calcium and vitamin D may lead to the softening of the bones, which is osteomalacia or rickets in children, and a loss of bone density, osteoporosis in adults. Infertility and miscarriage. Malabsorption of calcium and vitamin D can contribute to reproductive tissues. Lactose intolerance. Damage to your small intestine may cause you to experience abdominal pain and diarrhea after eating lactose-containing dairy products, even though they don't contain gluten. Once your intestine has healed, though, however, you may be able to tolerate dairy products again. However, some people may continue to experience lactose intolerance despite successful management of the celiac disease. Cancer. People with celiac disease who don't maintain a gluten-free diet have a greater risk of developing several forms of cancer, including intestinal lymphoma and small bowel cancer. Neurological problems. Some people with celiac disease may develop neurological problems such as seizures or peripheral neuropathy, disease of the nerves that leads to the hands and feet. In children, celiac disease can also lead to failure to thrive, delayed puberty, weight loss, irritability, and dental enamel defects, anemia, arthritis, and epilepsy. Non-responsive celiac disease. As many as 30% of people with celiac disease may not have or be able to maintain a good response to a gluten-free diet. This condition is known as non-responsive celiac disease, which is often due to contamination of the diet with gluten. Therefore, it's important to work with a dietitian for this. Refractory celiac disease. In rare instances, the intestinal injury of celiac disease persists and leads to substantial malabsorption, even though you have followed a strict gluten-free diet. This combination is known as refractory celiac disease. If you continue to experience signs and symptoms despite following a gluten-free diet, for 6 months to 1 year, your doctor may recommend further testing to overlook for any other explanations for your symptoms. All patients with celiac disease should be followed up to monitor the response of their disease to the treatments. Undiagnosed or untreated celiac disease can lead to long-term health conditions such as iron deficiency, anemia, early onset osteoporosis or osteopenia, infertility and miscarriage, lactose intolerance, vitamin and mineral deficiencies, central and peripheral nervous system disorders, pancreatic insufficiency, intestinal lymphomas and other GI cancers, malignancies, gallbladder malfunction, neurological manifestations including ataxia, epileptic seizures, dementia, migraine, neuropathy, myopathy, and multifocal leukoencephalopathy. Celiac disease diet. How do I get enough grains is maybe what you're wondering. Because people with celiac disease must avoid gluten, a protein found in certain foods containing wheat, barley, and rye. It can be challenging enough to try and get enough grains. Grains are an important part of the healthy diet, a good source of healthy carbohydrates, rest, vitamins, and minerals, and fiber. They are also naturally low in fat. When possible, choose foods made with enriched flours for added vitamins and minerals. Whole grains are even better for you. These include brown, black, or wild rice, quinoa, amaranth, pure buckwheat, corn, cornmeal, popcorn, millet, gluten-free oats, sorghum, and teff. Many large grocery stores and specialty food stores carry the ready-to-eat gluten-free grain products. Labels on such products will say gluten-free. Consider the suggestions in this following part of it for adding gluten-free grains to your diet. Gluten-free grains and grain products, serving size and whatnot you need to consider, which hopefully I'll bring out a table for this for you guys. Oats may not be harmful for most people with celiac disease. However, oat products are frequently contaminated with wheat. If your doctor or dietitian is okay with you trying oats, be sure to look for oats that are labeled gluten-free. Most gluten-free grain products aren't fortified with vitamins, so it's a good idea to take a vitamin supplement. Grain products that aren't gluten-free includes any type of wheat, including farina, gram flour, semolina, or durum, barley, rye, bulgur, kamut, matzo meal, spelt, triticale, couscous, emmer, and enocron. Well, this quickly ends basically a real short video of all about celiac disease. Give me the like for thumbs up, comment below. Feel free to follow me on my social media sites listed below. If you would like to be part of my fam, feel free to subscribe, because I'm hoping to do it on the daily, or even, as I said, Monday, Wednesday, Friday, at least 2 videos a week for you guys of each of those days. Feel free to also, if you made that choice, to turn on the notification bell so you can, get up to date with what I do. So share these videos around to your family and friends. So enough for the day, guys. Thanks for your support. Thanks for watching. Do what you love what you do. Until next time, Aspie signing out, and I'll see you again soon. Ciao for now.